Hey everyone! In this video, we are going to start talking about the bones. In this unit, this is probably going to be the most memorizing you're going to be doing through the year because we're not only memorizing the actual bones, but we're going to be memorizing their features and the portions that we tend to call landmarks. Landmarks tend to be noticeable differences on the bones or characteristics. A lot of them tend to be where muscles are going to attach, as well as areas that you're able to palpate. In other words, you can feel some of them on yourself as you learn these different bones. And so it can help if you can feel a landmark to associate with its location. This is We're not going to cover all the bones in one video. This video in particular is just going to cover the skull. As we go through the videos, we're going to talk about the axial skeleton first, which is your skull, vertebrae, and rib cage. And then once we cover the axial skeleton, we'll talk about the appendicular skeleton, which is the bones that make up your limbs, your shoulder girdle, and your pelvic girdle. Okay. In this video, as I mentioned, we're only going to cover the skull. As we go through, I will write down the labels, but you must make sure that you are writing down the physiology notes as well in order to earn credit. Okay, so if you only have the labels, that is not worth full credit. And I highly recommend that you write the label in one color and the description in another color, just to kind of help studying go a little easier. I know it's a lot on the diagrams, but we will have a chance to work with the skulls in class, and that will also help with this whole learning process. All right. That being said, let's go ahead and dive into the frontal aspect. So we're looking at the skull face on. And if we look at A, we're looking at the orbit. Okay, the orbit, in other words, is the eye socket. B is going to be the frontal bone. This is an easy one because the frontal bone is the forehead. It's protecting the frontal lobe of the brain. Similarly, on the side, we have the temporal bone. And the temporal bone, again, it's named for the lobe it's protecting, so this is protecting the temporal lobe of the brain. If you look at this bone back here, it's within the orbit in this diagram. This is the sphenoid bone. The sphenoid bone is actually right in the middle. You can see this a lot better internally. This here is the sphenoid as well. Over here, it's actually connected in the back. But because we're just looking at the frontal view, we can't actually see that connection. The sphenoid bone is internal, and it's shaped like a butterfly. We'll talk more about that later on. E is going to be your nasal bone. So this is the bridge of your nose. F is pointing to the zygomatic bone. The zygomatic bone is your cheekbones. G is the nasal septum. This is going to separate left and right nostrils. It's made of two bones that we're going to talk about later on. H is what we call the maxilla. The maxilla is the bone that holds your upper teeth. And then your jaw below, holding the lower teeth, is called the mandible. By the way, if you guys hear weird breathing noises, it's because Buford is currently snoring as he sits next to me. So I figured I'd let you know. He's very loud. All right. Oh my goodness, I just totally spelled mandible wrong. There we go. A lot better. All right, let's go ahead and move on to the next page, which is the lateral view. So we're looking at a side view. We've got a few more features here than what was present in the frontal view. So to start off, we have specific joints in our skull called sutures. These joints do not move. They are simply the joints of our bones in our skull that at birth they were separated, and then as we age they fuse together. Okay, so we call them a suture. A is the coronal suture. And the coronal suture is going to connect our frontal bone to our left and right parietal bones. It's called the coronal because it is essentially a coronal cut. So remember, the term coronal means separates front and back. B is our parietal bone. We have two of them, a left and a right. This protects the parietal lobe of the brain. C is the zygomatic process. Okay, so remember, zygomatic in our past page was our cheekbone. Whenever you see process means extension of. All right, so the zygomatic process is an extension of the zygomatic bone. And when you look at the actual skull, you'll see that it's kind of like a little bridge. D is our temporal bone, which protects the temporal lobe. And the temporal bone is going to be connected to our parietal bones, as well as the sphenoid through the squamous suture. Again, a suture is that fused joint. Towards the back, or the posterior side, we have the lambdoid suture. I know it's a strange word. And the lambdoid is going to, sorry, I just spelled that incorrectly. The lambdoid suture is going to connect our occipital to our parietal bones. Suture. And that being said, I'm going to jump ahead real quick. H is what's pointing to our occipital bone. Okay, so that occipital bone is protecting the occipital lobe, and it is connected to our our parietals through the lambdoid suture. Now there's a feature on the occipital bone right here. It's going to be a little more noticeable on the actual models. This is a landmark that we call the external occipital protuberance. So external meaning on the outside. I think we got that one. occipital because it's on the occipital bone, and protuberance because it protrudes from the bone. This is an important landmark because you're actually going to have muscle attachment here that as the muscle contracts, it will pull the head back so that you can look upward, and when it relaxes, you can return your head back to neutral. Another landmark, not a bone itself, is I, which is the mastoid process. We actually have some muscles that are going to attach here for chewing, because the process of chewing is called mastication. Therefore, it is mastoid. And again, process meaning it's an extension of. Just next to the mastoid process, we have this opening here. This is going to be the skeletal tunnel for your ear canal, and it is our external acoustic meatus. External acoustic meatus. And then just in front of that, we have another process. Kind of looks like a fang. This is called the styloid process. Again, process meaning extension. And the styloid process has small muscle attachment here. Okay. When you look at the skull itself, it's, like I said, it kind of looks like a fang. If you can think of like styloid, stiletto, that can kind of be just a little reminder word there. L, we've already covered this, is the mandible. Hold your lower teeth. Holding your upper teeth is the maxilla. And we have the cheekbone, which is the zygomatic bone. And the zygomatic bone is going to lead to the zygomatic process. The bridge of our nose, again, is the nasal bone. And just on the inside, posterior to the nasal bone, you can see this small bone here. This is called the lacrimal bone. The lacrimal bone is actually running next to the nasolacrimal duct. So if you think about that, the lacrimal duct is your tear duct. So right where your tear ducts are is where you can palpate your lacrimal bone. Q is the sphenoid bone. This is just the little portion that you can see outside of the skull. Most of the sphenoid bone is going to be internal. And then finally, R is our frontal bone. Okay. Now, let's go ahead and break down the mandible because there's quite a bit of features to the mandible. If we start off with S, this front notch here is called the coronoid process. Okay. That coronoid process then leads us to this notch here, which you can see here as well, which is labeled by U. And that notch is called the mandibular notch. Which then leads us to this structure here on the very back side, called the mandibular condyle. The mandibular condyle is where you're going to have articulation. In other words, where you're going to have movement. This movement is because this condyle is going to fit in what we call the mandibular fossa in the skull. We'll talk more about that in a little bit. Just below the mandibular condyle, we have T, which is hard to see here. You'll see it on the actual models. There's actually a hole in there. That hole is going to be a pathway for facial nerves and blood supply. The one on the inside of the mandible is called the mandibular foramen. Foramen, you are going to see a lot of. Foramen equals hole. And just for the sake of repetition, remember that process means extension of. Okay. The mandibular condyle then leads us to the ramus, which is the back surface of the mandible. We then have a shift in direction called the angle, which then leads us to the body, which is kind of like what you consider your jawline. And Z, this is another hole. Again, this is going to allow the passage of nerves and blood supply. The hole on the front of the mandible is called the mental foramen, all of which is part of the mandible. Okay. I know this looks overwhelming. I know it's a lot of information, but we're going to have a lot of practice, a lot of repetition, and we'll be able to use the models. So it seems like a lot, but we're going to work through all this together, okay? Let's go ahead and get to the next page here so that we can look at the top and bottom of the skull. In other words, the superior and inferior views. Superior view is going to be our most simplistic view of the skull. We're looking at the frontal bone, the coronal suture. Remember, coronal is a directional term meaning separating front and back. Okay, so here's the front, here's the back, right? We then have C, which are our parietal bones, because we have left and right. And D, which is our sagittal suture. That turned out sloppy. And if you recall our directional term, sagittal means down the middle or separating left and right. These terms are definitely going to come back when we are dissecting. So refreshing those directional terms is beneficial. Moving right along, E is going to be our lambdoid suture. And finally, F is our occipital bone. All right. That covers the superior, not a whole lot to it. Let's get into the inferior view. Quite a bit going on here. It looks kind of messy in the diagram, looks kind of messy in person, but once we start to familiarize ourselves with the different features and the names such as foramen and process, you'll kind of get the hint, okay, this says foramen, I should be looking for a hole, or this says process, I should be looking for something that sticks out. Okay, so it gets better. First off, this part here, the roof of your mouth, this is the palatine process. Okay. The palatine process has a lot of taste receptors, and that's why they call your taste your palate. So if you've ever heard of somebody saying that they have an advanced palate, it means that they can distinguish many different tastes. Just behind that palatine process, we have the palatine bone, which is this area. So the palatine process is an extension of the palatine bone. Just behind that, we have what's called the vomer. This is the opening to the nasal septum. This is much easier to see in person. Okay. There are 3 sections of the sphenoid that we can see in this view. The sphenoid is that butterfly-shaped bone that's in the smack dab middle of our skull. Again, I mentioned earlier, we can see more of it when we're looking at the internal view of the skull. Later on, we're going to look at just the sphenoid bone isolated in a diagram. But J is the greater wing, so the largest wing of the butterfly. K is our lateral pterygoid plate. Okay, so lateral meaning out to the side. And L is our medial pterygoid plate. When it comes to finding these plates, the medial and lateral pterygoids, I think it's easiest to find the vomer, which is this. It's actually like a tunnel. And so then you're looking for the walls next to the tunnel. So there's the wall that's closest is going to be our medial, and the wall that's furthest is going to be our lateral. Again, this is going to be helpful when we're looking at the actual model. So if we're confused with this diagram, don't worry about it. Okay, we'll get there. M is our mandibular fossa. The mandibular fossa is what the mandibular condyle rests in. So when you open and close your jaw, this is the other half of your joint, the part that's actually within the skull as your mandible itself opens and closes. Kind of works like a hinge. N is the styloid process, that fang-looking extension. O is our carotid canal. This is going to be the entrance for the internal carotid artery. And just against it, we have the jugular foramen. Okay, so this is where the jugular vein is going to pass through. On our models, I'm not sure why, the jugular foramen is an actual hole. It does pass through. However, most of our models, the carotid canal is just showing a divot. It doesn't actually go through as a complete hole, and I'm not sure why that is, but it does tend to trip people up as they look at it, because you would expect the canal to be a actual hole, because that's what it truly is, but unfortunately our models do not properly represent that. Q is the occipital condyles. These are technically part of the occipital bone, and they connect to your C1 vertebrae. They are involved in the nodding motion. So they are the other half of the joint required to nod. R is called the foramen magnum. In other words, it's the big hole. And this is where we're going to have our spinal cord pass through. So that's super important. And then finally, we're getting an inferior view of the protrusion back here that we know as the external occipital protuberance. And again, at the external occipital protuberance, we're going to have muscle attachment so that we can nod. Alright, just 2 more pages. I know that this video is info overload, but I want us to get through this massive amount of information so that we can then utilize it when we start using the models. Right, so here we're looking at a mid-sagittal section. Essentially, if we were to cut the head in half into left and right, this would be the inside view. Some of these we've already talked about. Actually, a lot of them we've talked about, so I won't mention too much about what we've already covered. A is frontal bone. And in the frontal bone, we have the frontal sinus. So your frontal sinus is the hollow region inside your frontal bone. This is what can get inflamed when you have a sinus infection. You have other sinuses as well, but this one is what you feel in your forehead. C is our nasal bone. And our nasal bone is made of 2 other structures. I'm going to jump down. The nasal bone is made from G, which is the perpendicular plate, as well as H, which is the vomer. Okay, so these 2 help make up the nasal bone. D is showing us the sphenoid. Oh, I'm so sorry. D is showing us the ethmoid. Sorry about that. The ethmoid bone is right in the center. It's just behind the nasal bone, and the ethmoid has 2 structures that are quite porous. They actually have quite a bit of holes. It's a little bit spongy because the ethmoid bone is going to have passage for your olfactory neurons. Your olfactory neurons are the neurons or receptors for smell. Okay, so we have the crista galli, which is this pointy structure. And then we have the cribriform plate. Cribriform plate. And the cribriform plate has all these little holes that you can see, and that's where we're going to have smell receptors or olfactory receptors. That way we can connect our sense of smell to our brain. I is our maxilla. J is our palatine bone. K is our mandible. L is our parietal bone. M is temporal. And then N, we have this fancy little structure that is within the sphenoid called the sella turcica. The sella turcica is going to be the house for the pituitary gland. It's a depression that the pituitary gland rests inside of. O is the occipital bone. P is going to connect with our external portion. This is going to be our internal acoustic meatus. Q is the sphenoid bone itself. And R is a hollow space within the sphenoid bone called the sphenoid sinus. So a sinus is a hollow space. All right. Bear with me, guys. One more to get through. So, as I've mentioned a couple of times, the sphenoid is internal. And so really we can see portions of it, but you don't see the full bone unless it is isolated. And from there we can actually really identify the individual features. There's also features of the temporal bone that we've gone over quite a few times, so we'll talk about those. And then finally, on the bottom of this page, we'll talk about the ethmoid bone, which is the bone that's right behind your nasal bone. All right. So up here we have the sphenoid bone. Let's go ahead and talk about that. All right. A, as I mentioned earlier, is the sella turcica. This is the depression that is going to support the pituitary gland. I also believe that I mentioned to you that the sphenoid bone is like a butterfly shape. This small little section here is what we call the lesser wing, while this region here is what we call the greater wing. There's a tall, I guess what we can call a wall, towards the back of the sella turcica. It kind of wraps up around the pituitary gland, This is called the dorsum cellae. In other words, sorry, that was Buford. In other words, dorsum meaning dorsal or backside, cellae as in cella. Okay, so the backside of the cella turcica. And then we have two foramens here. This one here, this oval-shaped one, is the foramen ovale. And C is the foramen rotundum. With the models, I will not ask you to identify these. Okay? They are passages for cranial nerves, but this is not a requirement for you to know. Okay, just below that, stop. Yeah. Sorry about that. Okay, we're looking at the temporal bone here in the middle. Specifically, this is the right side, just to give you a little bit of reference. Right temporal bone. The portion that is against where the squamous suture is called the squamous portion. Convenient, right? H is showing us our zygomatic process. So the little bridge that takes us to the cheekbone. I is the external acoustic meatus. J is our styloid process. And K is our mastoid process. Okay. Finally on this page, last part of the skull that we're covering is the ethmoid bone. Bone right behind the nasal bone. This structure that points in the superior direction, this is the crista galli. This is very easy to see in the skull and is going to be a great landmark for you when you're trying to figure out what in the world you're looking at when there's so many different features there. And then here we have the perpendicular plate. The perpendicular plate is going to lead us to our nasal septum. So this is going to separate the left and right sides of your nose. And within your nasal cavity, you have these structures. This isn't the greatest view. I'm going to draw over it. We have these structures called nasal concha. The purpose is to make you think of a conch shell. So you have the ones in the middle nasal concha. So there's one over here as well. And then you have the ones up high that I've highlighted over here, the superior nasal concha. If you think about a conch shell being that spiral shape, these bones are very similar. They're spiral, and what it encourages is for, as you breathe in through your nose, the air is going to be circulated in a swirling pattern, and that's going to help moisten the air and warm it up before it gets into your lungs. Just because dry, cold air is uncomfortable to breathe, and so this is just going to acclimate the air to make it more comfortable for your lungs. Okay? All right, that wraps up the skull. I know it's a lot. I highly recommend that you watch the video a couple times. Go over your diagrams as often as you can. But also, we're going to work with the actual models and use these diagrams at the same time. So this is possible, okay? It is manageable. It's going to be expected of you when you go into college, and with this being a 5-credit class, I expect you to work at that level of academics, essentially. So you are responsible for this information, but I don't want you to panic because I'm here to help you, okay? So again, you should have gone through, labeled your diagrams, written the descriptions and any physiology that was mentioned, and that is going to help prepare you for the hands-on portion of working with the models. All right? Okay, that's all, guys.